Welcome to the Giving Voice to Depression podcast. We're your co-hosts, Bridget
and Terry. Each week, we explore a different perspective on or experience of depression because it varies in form and severity, affecting us differently. Our guests share intimate details of their struggles, coping strategies, and recovery. We keep it real because the struggle is real. We keep it hopeful because there is hope, in spite of what depression tells you.
We're not experts or therapists. We're sisters and best friends who live with depression and know that talking about the illness reduces stigma and humanizes the experience, making it safer and easier to ask for needed support. You are far from alone.
Today's podcast is sponsored with a Garrett Kelly Memorial Grant from the Charles E. Kubly Foundation, in loving memory of Garrett and others who've struggled with depression. We are solely responsible for podcast content.
Hello, Terry.
Hello, Bridget.
Since last week's episode on depression in the medical field, the World Health Organization announced that it is updating its definition of burnout. It stops short of classifying it as a medical condition, though that was widely reported. However, it is bringing much-needed attention to the problem of work-related stress.
Mm-hmm. So the new World Health Organization definition requires that to diagnose burnout, mental health professionals have to rule out anxiety, mood, and other stress-related disorders. The organization also announced it plans to develop evidence-based guidelines on mental well-being in the workplace.
And now we're going to continue our discussion with trauma surgeon Dr. Michael Weinstein. In part one of his interview, we focused on the systematic changes that he thinks are necessary to reduce and address depression among doctors and other healthcare professionals.
While the many stresses of Dr. Weinstein's medical training and responsibilities may have increased his risk of depression, his family history may have too. Today we hear about Michael's personal experience with depression and the challenges and lessons of switching roles from being the doctor to the patient in the medical system.
My grandfather, who for the last 20-some years of his life, he was depressed in and out of facilities, very aggressive treatments, and I think I saw that and saw that that's my destiny, and I'm not hitting it at 65 or 70. I'm hitting it at, well, I guess I was 48, and that's the only future I could see. And that's the scariest thing in the world, because that pain, when it's deep, really bad depression, it was just severe. Like every minute of the day was occupied with thoughts and feelings that I didn't know how to make go away, certainly, and didn't really even know how to lessen them. And you feel so trapped.
Were they all related to being worthless, being a burden, everyone would be better off without you kind of thoughts?
Yes, absolutely. It starts more mild. It started more mild, I should say, for me at least, with thoughts of failure, and then finding, evidence of failure in everything you're doing, and then feeling, depressed about feeling like a failure, and it just keeps adding and adding multiple layers until I felt. I mean, it's hard for me to even say these days, but I truly felt that I was a burden on my family and my wife and kids, and that they were the only things that were ever in my life holding me back from considering suicide. But I got to a point where I really thought my mind could convince me that they'd be better off if I weren't there. And certainly the world and everyone else would be a better place without me. You hear, I mean, I had never really heard those types of thoughts from anyone else, or heard people speak that way.
But what a dastardly illness. I mean, to convince you, A, you're not sick, you're just worthless, and then
Right.
to tell you that the people for whom you would live,
Mm-hmm.
I don't even know what words to use. I mean, how as a community, as a medical community, as just a general public, do we communicate this to both sides, to the people who might lose someone with depression and to somebody with it? How do we say it's that bad and get involved? Or what's the message, doctor? Help me.
Well, I mean, I think the work you're doing, for instance, is key in getting this message out and hearing as many stories, especially when people, I think when people are in the throes of it, it can be really hard to hear. But if people can hear these messages before that, and as they're beginning to recover, because everyone can recover, I really believe that so deeply in my heart. I remember the first day that it really was starting to lift, and I called my wife and just said, this is the first time I'm just so happy to be alive and so happy that that you guys kept me from taking action otherwise. And there's so many reasons and so many ways to find little bits of joy and meaning that it's I don't know how to get that message out other than keep talking about it and having these conversations and destigmatizing these conversations so that people can listen and hear it on national platforms, international platforms.
You described yourself as having treatment-resistant depression. And when I read that, I thought, there will be people listening who are so glad to hear a doctor use that phrase because they've been told by doctors, basically nothing works for you, like as if they're just difficult, as opposed to the things that they've been prescribed have been ineffective for them. So treatment-resistant depression, it's real and you have it?
Oh, God. Fortunately, right now I don't.
Good.
Which is interesting because in the throes of it, so this is now going about 2 years ago, certainly the worst episode of depression I've ever had. Nothing was working, nothing at all. Talking to all sorts of people, different types of therapy, constant attempts at medication changes. So that is treatment-resistant depression, where there's nothing you're throwing at it is working, and it's so scary. I called it end-stage depression. Which I'm not sure truly. I don't think truly exists in my heart. But I thought damn well I had it, and I thought I was never going to get better.
So we want to stop for a minute to say we're about to get into some of Michael's really rocky waters and talk about that place of lost hope. But please realize he is speaking about his past. Michael's in a different place now, and that is exactly why he's sharing his story. He wants to remind you, all of us, that things can and do change for the better. Please hold on. You are not alone.
I checked myself in with my wife to an institution for psychiatric care, and it was there voluntarily. I didn't necessarily want to be there. It was scary as hell just to admit that I was going to a psychiatric hospital. I certainly thought that would end my career.
Since Michael had tried so many treatments that didn't work for him, as both a doctor and a grandson, he knew what was next.
The way the medical community sees the treatment of depression, it's medicines, some psychotherapy, and then there are the big ones. And they quickly recommended, aggressive treatment with electroconvulsive therapy.
He started that therapy and fell even deeper into depression's dark pit.
And then I sunk into bed and wouldn't get out, wouldn't eat, and I understand from their standpoint, they were in charge of keeping me safe. And said, kind of threatened me if I didn't start getting with the program. This is what's going to happen. We're going to put you in the locked ward, and I freaked out.
Suffice it to say, Michael resisted. he was restrained and forcibly taken to an isolation room.
It's a really hard thing to go through. I get it. It's about safety. I think there are better ways to interact with patients when it comes down to those critical times that sometimes aren't always used in terms of de-escalation and ways of putting people on your side rather than forcing them to become defensive. But at the same time, as hard as that whole thing was, it was humbling to be amongst a different population of folks. It was also in some ways interesting. I learned about, kind of being on their side and being on the other side of this whole type of situation of care.
How'd you get from there to here?
What a crazy journey, huh?
Yeah.
So being in the psychiatric hospital with other people who were, I was amazed. You have those types of thoughts too.
Yeah.
And so, I realized that if people could realize that they're not alone and that it's okay. And if anything, even it's a strength and it's a courage to openly talk about these issues, and you don't need to be ashamed to do so. I wanted to show people that because my main motive, I don't want anyone to ever have to go through what I went through. If I can possibly help you avoid this, I would really like to. It's amazing that, we can talk about the issues and we can talk about statistics. The story and the narrative is so powerful. I'm just amazed that people can always identify parts of themselves in someone else's story.
You can say 350 million people and you can say 1 in 4.
Right.
That's like talking about the national debt to me.
Right.
None of it means anything. I think that's a lot of people. But
Right.
when you say to me, and I was restrained, I feel that in my gut.
Right.
And I'm not going to forget that. What is the expression? What is personal is universal. It's also a way that we get to control the narrative.
Right.
I think that that's very empowering in a way.
Yes.
In the article, Michael wrote about his experience for the New England Journal of Medicine. He said, "My healing has been considerable. I am happier and more optimistic than I have ever been in the past 50 years.
I've recovered in ways that I really thought were I still find them so surprising. For a while, I wanted to tell the story that I recovered and everything is great and hunky dory, and it's like the journey of the hero or something. And but that's not life, and life has its ups and downs, and it's learning to work with that and encounter those and realize that it's all just as it should be, and it will unfold, and it will, you can work through anything that arises. Every human has that possibility.
So true, yet so difficult to use as a raft to buoy you up when you're in the deep, dark waters.
Mm-hmm. But that's why we're talking about it, and that's why we need to hear each other's stories so that when we're in it, we can hear from other people who were and trust them when they say there are ways out.
Absolutely, there are ways out. We're going to link to Michael's article as well as a beautiful YouTube video about his journey.
Mm-hmm. He also, I didn't use it in this piece, but during the interview, he mentioned a book that had been really helpful to him. It was about mindfulness, and he said it helped him with his recovery. I have not yet read it. I ordered it and got the workbook instead of the book by mistake, but we will post a link to it on his recommendation.
And next week's episode will be on the Lifeline text line, and that is 741-741.
Yeah, there are a lot of people who prefer to text versus call, whether that's an energy thing or a privacy thing or any number of reasons. And we'll look into what all of those are and just what an amazing job they're doing. And I just want to end this using the same words that Dr. Weinstein used to end the story, which was, you can work through anything that arises. Every human has that possibility. So please keep hope.
Mm-hmm. Bye, Terry.
Bye, Bridget, and thank you, Dr. Weinstein.
We truly hope that our podcast brings a little more understanding, helps you better articulate your experience of depression, or better understand how to support someone else's.
We invite you to join us for daily posts on the Giving Voice to Depression Facebook page and on Twitter and Instagram at Voice Depression. It is a comfort to be among fellow travelers on depression's dark road.
And remember, if you're struggling, speak up. If someone else is, listen up.